Good morning, Dr. Smith. Thank you for seeing me today. I made my appointment this morning.
Good morning, Anna. Welcome to my office. Please tell me what seems to be the main problem today.
I do not feel very well, doctor. I have felt sick since yesterday afternoon. I am feeling quite weak and unwell.
I see. Can you tell me exactly what your symptoms are? Please explain how you are feeling right now.
I have a bad headache that will not stop. I also have a lot of pain in my throat when I speak or swallow.
A headache and a very sore throat. Have you had any sickness in your stomach recently?
No, my stomach is fine, thank you. I just have trouble swallowing food and even water. My throat feels very raw.
Have you been coughing very much in the last few days? Do you have any problems with your breathing?
I have a small, dry cough sometimes, but it is not too serious. My breathing is completely normal, thank you.
Do you feel hot, Anna? Do you think you might have a high temperature right now?
I do feel very warm sometimes when I sit down. I did not take my temperature at home this morning.
We will check your temperature here in a moment to be sure. How long have you had this severe pain in your throat?
The pain started strongly late yesterday. It became much worse during the night while I was trying to sleep.
Did you manage to sleep well last night? Getting good rest is very important when you are sick.
I did not sleep well at all last night. I woke up many times because of the throbbing pain in my head.
I am sorry to hear that you had a very bad night. We will try to find the cause of your sickness quickly.
Thank you, doctor. I really need to feel better soon. I have to return to my important job next week.
We will do our very best to help you feel better quickly. First, tell me if you have any allergies to common medicine.
No, I do not have any known allergies. I can usually take almost any kind of regular medicine.
That is good. I will first examine your throat closely now. Please open your mouth wide for me to see inside.
Is my throat very red? I looked quickly in the mirror this morning and it looked quite bad.
Yes, your throat looks very red and quite irritated. I will check for any swelling now with my light.
I hope it is nothing too serious, doctor. I feel a bit nervous about this persistent pain.
Please do not worry, Anna. We will take good care of you here. We will start with a simple checkup first.
Thank you for being so reassuring. I feel a little calmer now that I am here in your office.
Now I will check your neck and glands carefully. Does it hurt when I touch you here on the side of your neck?
Yes, it hurts quite a bit right there. The pain is sharp when I move my head or try to talk much.
I see some slight swelling in this area. Now, please stick out your tongue for me. I need to look closer.
Is that white color normal? I noticed a strange coating on my tongue this morning.
I am looking at that now. It looks like a common irritation. Nothing too severe right now.
I have also started to lose my voice a little bit. It is hard to speak loudly without pain.
Voice loss often happens with a sore throat. Please try to rest your voice as much as you can today.
I will try to be quiet. My job requires a lot of talking, but I will try not to speak at home.
Now, let's take your temperature quickly. Please hold this thermometer under your arm for a moment.
Okay, I am holding it tightly. I hope the number is not too high. I do not like high fevers.
I am checking the thermometer. Your temperature is slightly elevated. It is a little above the normal level.
What is the exact temperature reading? Is it high enough to cause my persistent headache?
Your temperature is 37.8 degrees Celsius. This is a mild fever, and it is likely causing your headache.
I see. I feel much hotter than a mild fever, actually. I feel hot and cold alternately.
That feeling is very common when the fever is starting. You may experience some shivering later.
I also feel very tired all the time. I cannot concentrate on any tasks for very long.
Extreme tiredness is another clear sign of your body fighting the infection. You need full rest.
I hope this feeling of weakness goes away soon. I want to feel strong and energetic again.
We are almost finished with the checkup now. I have a clear picture of your symptoms.
Thank you, doctor. I trust your judgment completely. What do you think is making me sick?
It seems you have a common viral infection, likely a bad cold or mild flu. We will discuss the treatment plan soon.
A viral infection means I cannot take strong antibiotics, right? I learned that is often true.
That is correct. Antibiotics are only effective against bacteria. We will focus on relieving your symptoms now.
What kind of relief can you recommend for my severe headache? It is the most annoying symptom.
We will discuss specific pain relief medication in the next step. It will help with both the pain and the fever. I have noted all your symptoms clearly. Now, before I give you advice, I need to know a few things about your recent life.
Of course, doctor. I am ready to answer all your questions honestly. Ask me anything you need to know.
Have you been very stressed or busy recently at your job? High stress can sometimes affect your body's strength.
Yes, I have been working very long hours this past month. I have had many late nights finishing big projects.
Long work hours can weaken your body's defenses. It makes you more likely to catch a cold or a virus easily.
I suspected that might be the case. I have not felt well rested for many weeks now.
Do you usually drink a lot of water every day? Staying hydrated is crucial when you have a sore throat.
I drink coffee every morning, but I often forget to drink enough plain water during the day. I think I need to drink more.
You must drink lots of water and warm tea starting immediately. Warm liquids will help soothe the painful area in your throat.
That makes sense. I will start drinking warm herbal tea as soon as I leave your office.
Have you been in contact with any other sick people recently? Did a friend or colleague have similar symptoms?
My friend next door was coughing badly all of last week. Perhaps I caught the infection from her when we had coffee.
That is very possible, as these types of viruses spread very quickly from person to person. We need to focus on recovery now.
What about my diet? Should I avoid any specific types of food while I am feeling sick?
Try to eat light, simple meals that are easy to swallow. Hot soup and soft foods are the best choices for your throat right now.
Okay, I will buy some nice vegetables to make a warm soup later today. That sounds comforting.
Also, you need to stay home from work for at least 2 days. You need complete and total rest.
2 days off work is possible for me. I will call my office and tell them I must stay at home.
You should stay in a warm bed and try to sleep as much as possible. Sleep is the best medicine for a viral infection.
I understand, doctor. I will go straight home after this appointment and not stop anywhere else.
Good. Now that I have all the details, I will write down the specific treatment plan for you.
Thank you, doctor. I am eager to know exactly what kind of medicine I should take.
We will focus on the fever, the headache, and the throat pain. I will write a prescription for the pharmacy now.
I want to check your temperature once more now. Please open your mouth slightly for me to use the thermometer under your tongue.
Okay, I will hold it very still. I hope the number is lower than it was before.
Your temperature is still slightly elevated. It remains at a mild fever level.
I still feel quite warm, but my headache feels a little better now. Maybe the fever will start to drop soon.
We need to address that fever and the headache with specific medication. I will write a prescription for a common pain reliever now.
What kind of medicine will you prescribe for me, doctor? I need something strong for the headache pain.
I am prescribing a standard tablet that treats both fever and pain. You can buy this immediately at any pharmacy.
How often should I take this pain relief tablet? Should I take it with food or on an empty stomach?
You should take one tablet every 4 to 6 hours as needed for the pain. Always take the tablet with a little food or a large glass of water.
I understand. One tablet every 4 to 6 hours with food. I will set a reminder on my phone to take it regularly.
Do not take more than 4 tablets in one full day. It is important not to exceed the safe maximum dose.
I will follow the instructions exactly and not take too much medicine. Safety is very important to me.
For your sore throat, you should buy some special lozenges. These are small tablets you slowly dissolve in your mouth.
Lozenges sound good for the pain. Will they numb the area so swallowing is easier?
Yes, the lozenges will soothe the irritation in your throat. You can use these several times throughout the day.
Should I also gargle with salt water for my throat? I remember my mother saying that helps a lot.
Gargling with warm salt water is an excellent traditional remedy. You can do this 3 or 4 times every day.
I will gargle with the salt water and use the lozenges. I will do everything I can to help my throat heal.
Also, remember the importance of rest. You must stay home and avoid all stressful activity for 2 days.
I will call my boss as soon as I leave here. I will stay in bed and focus only on sleeping and recovery.
That is the best plan for a quick recovery from this virus. Do not try to exercise or clean your house.
I promise I will rest completely. I will only get up to make my soup and my warm tea.
Very good. I am finishing writing the prescription note now. You can take this directly to the pharmacy.
Thank you, doctor. This detailed advice is very helpful for my recovery.
Here is your prescription note and a sheet of instructions. Please take this immediately to the nearest pharmacy to purchase the tablets.
Thank you, doctor. I will go to the pharmacy right after I leave your building. I want to start the treatment right away.
Remember, the most important instruction is the rest. You must stay home and avoid all contact with other people for 2 days.
I understand I need to be isolated. I will not leave my apartment at all for the next 48 hours.
When you are sleeping,
try to keep your head slightly elevated. This position can help drain the congestion and make breathing easier.
That is a very good tip for sleeping better. I will put an extra pillow under my head tonight when I go to bed.
Continue drinking plenty of warm, clear fluids throughout the entire day. The warmth is important for reducing throat pain.
I will drink warm tea and water every hour. I need to keep the fluids going into my body.
If your fever does not drop after 2 full days, you must call my office again. We may need to schedule another small appointment.
So, if the fever is still high on Friday morning, I should call you back. I will write that date down now.
Yes, call us if your condition worsens or if you develop any new severe symptoms. We must monitor your progress.
What if my headache comes back very strongly even after taking the prescribed tablet? Should I worry then?
If the pain is severe and the tablet does not help, you should call our emergency line. We can give you further instructions.
I will keep the emergency number close to my phone at home. I hope I do not have to use that number.
Do not hesitate to call if you are concerned about anything at all. It is always better to ask than to worry alone.
Thank you for your kindness, doctor. Your confidence makes me feel much calmer about being sick.
Now, make sure you eat small, nutritious meals. Your body needs energy to fight this viral infection effectively.
I will focus on having soup and simple soft rice. I cannot eat anything heavy or spicy right now.
That is a sensible diet plan for recovery. Listen to your body and only eat what feels comfortable to swallow.
I think I understand the complete treatment plan now. I have the prescription and the sheet of instructions.
Excellent. I will see you out to the door now. Remember to wash your hands often to stop the spread of the virus.
I will wash my hands very frequently today. Thank you again for all your expert help.
You are very welcome, Anna. I wish you a very speedy and complete recovery.
Thank you very much, Dr. Smith. I feel so much better just knowing what the problem is. Your advice has been very helpful.
I am glad I could help you today, Anna. Remember to prioritize rest above everything else for the next 2 days.
I promise I will go straight home now. I will not stop at any other places before going directly to my bed.
That is the best plan you can have for a quick recovery. Start the pain relief tablets as soon as you get them from the pharmacy.
I will take the first tablet with my warm soup as soon as I arrive home. I will also start gargling with salt water immediately.
Excellent! Remember to keep drinking those warm fluids very regularly throughout the day. Hydration is key to getting better.
I will drink warm tea and water every hour, just as you instructed me. I will also use the extra pillow to keep my head up.
Please monitor your temperature closely over the next day or 2. If it rises much higher, please let us know right away.
I will check my temperature every 4 hours at home. I will definitely call your emergency line if the fever becomes too high.
Good. I trust you to follow these simple instructions precisely. We want you to feel healthy again very soon.
Thank you again for being so thorough and kind during my visit. You are a wonderful doctor.
It is my job to ensure all my patients feel secure. I wish you a very speedy recovery, Anna.
I will try to sleep for a very long time now. Sleep is the best medicine, as you told me earlier.
That is completely true. Do not forget to call your workplace to let them know you will be absent for 2 days.
I will make that call from my comfortable bed at home. I will not push myself to work at all.
I will make a note in your file to check up on you in a few days. We care about your continued progress.
That is very thoughtful of you, doctor. I appreciate the extra care you are providing me.
You are very welcome. If you have any new symptoms, we are just a phone call away.
I will keep the prescription and the phone number safe on my bedside table.
Goodbye, Anna. I hope to see you healthy and well the next time you visit.
Goodbye, Dr. Smith. Thank you for everything. Have a good day.
You too.